Hi, my name is Dr. Scott Gersch from Gersch Orthodontics in Westfield, Linden, and Cranford, New Jersey. And today we're going to talk about how to turn an expander. An expander is a very simple appliance. We often use it for a phase 1 treatment to help create some space, often when we have a cross bite in the back where the teeth are not and the bite is not coming together. Sometimes to increase the arch perimeter. It's used for a number of different reasons. We usually use what's called a Hyrax appliance, which looks similar to this. It has a precision screw that we can control exactly. There are some that have little springs, but we can't control the exact amount of expansion, while this we can control down to the 1/4 millimeter. This is the key that we use. It's very simple. It kind of goes in the appliance and we turn it back. In fact, we have a short video here that kind of explains it a little bit more detail. What happens is when a patient has a cross bite in the back, the appliance sometimes looks like this. We usually don't even have the bands on these bicuspids here. But the key goes in the little keyhole and you push it back until you can't go anymore. Another keyhole appears, and then about 2 days later you're able to do that. As we do it, it slowly expands the upper jaw over the next few weeks. It doesn't hurt the patient. It's very simple. In fact, we have our beautiful assistant Jordan here today, and we're going to do it so we can see. So we can see on this video, the appliance had 4 bands. Usually we use one that only has 2 bands. I'm going to sit you back, Jordan, okay? And sometimes we use one like Jordan has that's a little smaller or a low profile. Okay, so why don't you slide back in the chair. This is made specifically for your ponytail. And open real big, chin way up in the air. I see we have a little bubble of saliva, but we could see that there's a little hole here and chin way up in the air for me. It's hard to see, but there's a little arrow here and it's pointing back. What you're going to do is take this key. I'm going to explain it as if you're standing there right next to me. What you're going to do is have your child kind of sit just like this at home, maybe on the bed, on the couch. If you're a righty, sit on their right side. If you're lefty, sit on their left side. You're going to have the key go in kind of straight like this. You can see this white part, if you're a righty, will be facing you. If you're a lefty, the part more with the writing would be facing you. All right? And you're going to put it in like that. The key has a little offset, so you're not going to push it in too far or hurt anyone. All right? And chin way up in the air. Turn a little so the camera so we can see it a little bit more and open as big as you can. So you take the key and you put it right into this little hole. When it's in there, open real big for me, honey. It's nice and solid. You don't have to do that, but you'll see that it's secure. And all you're going to do is take it and push back so you can't go anymore. You sometimes hear that click, sometimes you don't, but you'll see that little hole. Now wiggle it right down towards her tongue and take it out, and that's it. How'd that feel? Not so bad, right? I usually describe it to people as it doesn't hurt. Some people feel it's a little tight. Some people say it tickles. I say it's kind of like if I were to grab your arm like this. I'm not hurting you, am I? No, but you feel my hand. And sometimes you feel that little pressure right around here, right around your nose. For each patient, we'll describe how often you need to turn it, but usually we like to do it every other day. It doesn't matter when you do it. We like to say do it at night, make it part of that evening routine. We're going to brush our teeth, we're going to turn the expander, but if you do it one day in the morning, the next time at night, or whatever it may be, it's not a problem. It's as simple as that. The appliance is really easy, it doesn't hurt. Sometimes the first day or so, remember you had some extra saliva, but that is it, all right? So again, this is Scott Gersch from Gersch Orthodontics, and that's how we turn an expander, all right?